Hi, welcome to Codecast. Today we're talking with Dr. Mark Cruz, who is a psychologist for AFD, Austin Fire Department, and EMS. And today we're going to be talking about hoarding. So stay tuned to learn more about hoarding as a disease. In this episode, we're going to talk about what hoarding is, how to know and recognize the signs of hoarding, and how you can help. Can you give us an overall explanation of what hoarding is?
So as just a quick reminder, hoarding refers to not only the kind of accumulation of a great number of things, regardless of their actual value, but the significant distress that's associated with the idea of getting rid of it. And so we believe that about 2 to 5% of the population suffers from some form of hoarding disorder. And so the chances are pretty good that someone that you know is struggling with this. Is
hoarding then considered a disease?
Yes, hoarding is actually recognized as a disorder by the American Psychiatric Association. We know that it's associated with a number of other diseases, including things like obsessive compulsive disorder, major depression disorder, generalized anxiety disorder, and a few other things, but it is considered its own disorder.
Have you heard or know that it affects one gender more than the other?
It's really pretty interesting. We believe, and this is hard because a lot of people don't spontaneously endorse these things. A lot of people who suffer from hoarding are really quite embarrassed about it. But we believe that we think that males are slightly more likely to be hoarders. Although when we look at the people who eventually do seek treatment, women are much more likely to actually seek treatment.
Is there any telling signs for the general audience? Like, am I able to spot someone that has a hoarding behavior, or that is there anything that kind of signals to people that they're experiencing this or that they're possibly going through something like this?
Like we just talked about, a lot of people really try to hide hoarding from other people, and there is a significant amount of embarrassment that's associated with it, and oftentimes it's because they've received negative feedback from people in the past, and so it can really be difficult for people on the outside to have a true understanding of how much hoarding's going on. Some of the signs that we might see is that you might have someone who you're friends with and they won't invite you over to their home. There's always a reason for it, always an excuse for it. And even if you go and pick that person up, they're going to be waiting outside for you. And even if you urgently need to use the restroom, there's going to be an excuse for why you can't go inside. Other things that we might see is some of the signs of people having kind of an excessive preoccupation with acquiring new items. So, for example, if at the end of a staff kind of get together, someone's going around and making sure that they're saving all of the plates and all of the napkins and things that we might not view as having much value, not wanting those to be discarded. We might also see people have a hard time even in their own office space getting rid of things that don't matter. They might not want it to see other people who are trying to recycle old newspapers or magazines. There's just this preoccupation with kind of acquiring stuff based on the belief that there might be some value to it.
I mean, what I imagine from the environment that a hoarder lives in, descriptively, I can imagine just a place that's highly saturated with things. And we perceive that as being perhaps overwhelming. What is the perception from a hoarder when they're in that environment?
I think it's overwhelming, but it's overwhelming from a different perspective. I think if you or I walk into a hoarder's home, someone who's really gathered a lot of stuff, we are overwhelmed by the amount of stuff. Mm-hmm. And then when we start getting a closer look, we're overwhelmed by the amount of things that we consider to have really low value, mm-hmm.
Mm-hmm.
What we might consider to be junk or what we might consider to be trash in some instances, that we get overwhelmed by the sheer amount of stuff.
Mm-hmm.
Whereas I think people who are struggling with hoarding, they're more overwhelmed by the emotional attachment to things, and sometimes the more full their space gets, then the worry becomes how to kind of acquire additional space, or what they're going to do when they run out of space.
Mm.
And so they are also overwhelmed, but it's overwhelmed from a different perspective.
And I think that's when it becomes more obvious to perhaps the neighbors when they start looking for things to hide outside in the shed or in the garage, or that's when it kind of starts spilling out of the house.
On the back porch and under the crawl space.
And it becomes a little bit more public,
yes.
right? That people start realizing that that's perhaps not what they're used to and
Yes.
consider normal in their own environment.
Yes, and even for folks who are considering trying to reduce or trying to prioritize, by the time they get to that point, it really has become an overwhelming task. You know, I know that my wife gets frustrated when things build up on my bathroom counter, and sometimes it's easier just to ignore that part of the house when we walk by. But if you can imagine an entire house that's full, in some cases, from ceiling to floor, and so much so that people have to kind of almost build little pathways to be able to walk through the houses. It really is an overwhelming experience to try to meaningfully organize that.
And that in the storyline, it makes sense, you know, to have that conversation with someone. If you realize, I imagine that I have like a family member that is experiencing this type of hoarding behavior, it would be, I guess, good to first acknowledge that this is going on, to have a conversation, a healthy conversation, a friendly conversation as to, you know, why are you acquiring and holding on to these things, and slowly in digestible bites kind of introduce tips to not add more, and then try to kind of find the root of it and try to help. And I think that would be something that is doable for people until eventually you can get professional help or encourage them to get professional help.
Right. And if you can get people to acknowledge that they would like to make a reduction, right? So even if you can get someone to say, oh, it'd be nice if I could get rid of 10% of this. Or it'd be nice if I could sleep on my own bed again. You know, it depends on the level of severity that they're at. And then that allows that door to become open. Okay, well, what are some of the things that you know, mom or dad or brother or sister or aunt or uncle that we know we don't need? What are some things that we know, okay, we don't need this. All right, well, I guess any of the coupons that have expired, you know, even if it's something small with that. But this idea of making these graduated steps, and it gives the person opportunity to feel successful and to also feel as though they have some control. Because if you take that control away from a person, it's likely to lead to them feeling more distressed as opposed to less.
So let's talk about the healing process. Is there a healing process for hoarders?
With any type of treatment, that's the goal, right? You want people to feel less tied to these possessions. That is one of the big goals that we have. We want them to establish their own identity outside of kind of a collector of these possessions. And so the extent to which you can remove the emotional attachment to that is one of the signs that we look for. And another signs that we're going to be looking for evidence that people are doing better behaviorally, that they're engaging in more social things, that they're taking other steps to take care of themselves. And you really want people to be able to start utilizing and seeing the benefits if they make these changes for that.
And I'm assuming that just like there is a healing process, there's possibility to relapse.
Yeah, anytime stressors get increased, right? And again, it's every person's going to be a little bit different. You can imagine someone for whom this provides an opportunity to have some control over your life experiences. If all of a sudden they lose their job, or a marriage ends, or something,
an emotional trigger.
Yes, that might, you know, kind of reinvigorate that desire to control some aspect of their life. And so we want to be mindful of kind of what those areas are, and then be able to provide someone with maybe a different coping strategy that might be healthier, or at least less destructive to their well-being.
What are some of those approaches to help assist someone who's suffering from this disease?
If you know someone who's struggling with hoarding, there are a couple things we want you to bear in mind. First of all, it is an actual disorder, and there are actual treatments for it. there's really effective treatments, and we strongly encourage people who are thinking about making changes to work with someone who's trained in cognitive behavioral therapy. The second, if you're a family member of someone who is struggling with hoarding, we want you to reach out to them and to let the person know that you love them and that you care about them, and to begin the process of trying to get them to think about how might they want their lives to be a little bit differently. It can really be very traumatic to go into someone's home and to remove a whole bunch of items from them that they believe have some significant value. So instead, we want to talk with them about identifying what their goals are, and then you can be the support to help them get connected to the resources to make that happen.
Anything that you'd like to conclude with?
I'm really quite happy that this is an issue that the Austin Code Department is trying to address and trying to educate not only its members and our city employees, but the entire community about. We believe that somewhere between 2 to 5% of the U.S. population has characteristics associated with hoarding. And so chances are you know someone. You may not know that they're dealing with it, but chances are we know someone who is.
Please share this podcast topic with someone you feel may benefit from it, and stay tuned for a future podcast from the Austin Code Department.